health insurance isn't health care. Right? A lot of people have health insurance, but they have lousy access to their physician. They can really never get in when they want to get in. It takes them 3 weeks to get an appointment, and they wait 2 hours in the waiting room for 2 minutes with the doctor. And that kind of thing doesn't happen at ProPartners. There's really never any waiting. We always offer same-day appointments. We talk about the triple aim of healthcare, which is improving the quality of care. Number 2 is improving the patient experience. And number 3 is improving or decreasing healthcare cost. They usually say, better, faster, cheaper. You can't have all 3. When it comes to ProPartners and the kind of practice we have, you really can have all 3. The way that primary care is practiced in the United States, it's really driven by insurance. And we call most family practice and primary care volume-based care, which means the more patients the doctor sees, the more money the doctor makes, the more tests they order. Those are things that are not aligned with the interests of patients. And so ProPartners became a value-based practice. It's not volume-based, it's value-based. So our physicians are fully aligned with the interests of our patients. We don't make more money if we do more services. We don't make more money if we make someone drive to our office. For insurance, a lot of times doctors only get reimbursed if they make someone come into their office. So they require visits on site for things that really could easily be taken care of by phone or text or video chat or something like that. It's so convenient to come to ProPartners that people don't avoid doing preventive medicine. They don't avoid coming in for a checkup because they don't have to wait. And so they're more likely to get timely care for preventive care. They're more likely to even make healthy lifestyle choices because they have a relationship with their doctor, which means they don't end up going to specialists as often. They don't end up having as many MRIs and CAT scans, and even hospitalizations are decreased when someone knows that they have direct access to their primary physician whenever they need it. The change we made from this high volume primary care practice to direct primary care membership based has allowed me to decrease the total number of patients that I'm responsible for to about 1/3 of what it used to be. So think about that. I've got 3 times as much time that I can interact with my patients, either by phone or in person. And so there's never a hurried or rushed visit. And so I literally can sit down and get to know the patients in a way that I never could in that old business model. What happens to somebody if they can't get in to see their doctor? They end up in the emergency room for something that really doesn't require emergency care, so it becomes very expensive and inconvenient. We save our patients money in a lot of ways. First of all, they pay a flat, low monthly fee for unlimited, unrestricted access to their doctor, so there aren't office visit charges and co-payments and deductibles. We also have negotiated a really, really low cash prices on lab tests, x-rays, MRIs, CAT scans, colonoscopies for cash prices. Some of our patients don't have full major medical insurance, or their deductibles are so high, it's as if they're paying cash for everything. And all of those things that we've negotiated for are pass-throughs. We don't make any money on any of those things. And so, for example, lab tests here we charge our patients about 10% of what the retail cost is, which turns out to be about 1/3 of what even the insurance-based pricing is for lab tests. And the co-payments that people pay on CAT scans and MRIs are typically higher than the cash prices that we've negotiated with area imaging centers.